need to, there you go. Good morning.
Good morning.
Good morning, Dr. Were. I'm told that you might have to leave for a few minutes, but I wanted the participants to hear a hello from you. The other panelists that we are anticipating getting are Dr. Andrew Mulwa, who is Minister of Health at Makueni County, who is also the chair of the County Ministers of Health. Dr. Mulwa, are you on the call? And are you able to say hello to us? I can see you on the call. You're sitting in a very nice sunny spot outside. Say hello, Dr. Mulwa. You're on mute, doctor. You might have to unmute yourself.
Okay, thank you very much. Thank you for the invitation. I should be able to stay on and have this conversation and launch the report. Otherwise, on behalf of the 47 county CECs of health, I must appreciate the work that you have done in those few days. Thank you.
We really appreciate your presence. It's important that you are here to give us deep perspective of the experience across the 47 counties medical departments. Thank you. We are also hoping to get on the call Dr. Korir Singoi, who is with the Office of the Deputy President and is the representative of the Open Government Partnership for the Government of Kenya. I should let you know that I'm also involved with the Open Government Partnership at the steering committee level, at the global level, and Kenya was elected to join the steering committee just a few months ago. So congratulations to Kenya, and we look forward to working together in terms of representing citizens at the Open Government Partnership area. So we hope Dr. Korir will join us at some point during the conversation, and he'll be able to participate as a panelist. Let me move very quickly then on to just mentioning really highlights about Twaweza. Twaweza is a civil society organization. We are registered in Kenya, in Uganda, and we're headquartered in Tanzania. Forces their lives, and we promote their active engagement, and we also, we also promote and support governments to be responsive to the citizens' needs. And this Sauti za Wananchi, this survey that you're going to be discussing today is directly related to providing the government's information from the citizens' perspective and hoping that there will be a close dialogue and a response from the government to the needs, expectations of the citizens. Apart from Sauti za Wananchi, where we amplify citizens' voices, we do advocacy to change policy, we research innovations to improve service delivery, and then we engage in creative media engagement and partnerships, and we focus a lot on learning from others, but also from our activities. Sauti za Wananchi, why do we have it? Citizens' voices are usually missing from public debate. Their experiences, their feedback, their problems, their perspectives, their preferences tend to be overshadowed usually by the needs of the louder members of society, whether they're in business, sometimes even civil society, and the political and technocratic elite. But what we try to do is make sure that the voices of citizens are actually heard. We've done now across the 3 countries since 2013, 90 surveys, 90, to inform public debate. We use mobile phones so that they can be done quickly to overcome time and cost challenges. We collect regular data on public interest issues and especially on service delivery issues around health, water, education being primary, but we go on to many other areas. We try to do turnaround of these surveys quickly so that they're actually live and fresh and informing ongoing policy debates. The panel, you'll hear about a panel of about 3,000 Kenyans that we reached this time round, is established through a baseline survey. Respondents are usually given a mobile phone and a solar charger so that we get as much a representative survey sample across the country as possible. The Wananchi is actually an innovation It is the first of its kind in Africa, and we actually have co-authored a book with the World Bank on how to do it. So those of you who may want to see more technically how we do the surveys, we can of course have a conversation and help you work with it. How have we worked with the government of Kenya? Over the years, we've worked with the Independent Police Oversight Authority prior to the previous elections. We've worked with the Ministry of Education, the Ministry of Water. We presented to the National Devolution Conference. We have worked with the County Governor of Elgeyo Marakwet, and we're very pleased and proud to be working closely with the Makueni County government. And so, Dr. Mulwe, we're really happy that you are able to join us on this national platform as well. So there's quite a bit of methodological work that if there are questions that arise of a technical nature, we can perhaps have that conversation. But right now, I'd like, after speaking for far too long, to introduce my colleague who has been, who is our specialist, our statistician, and that is Dr. James Shearer. Dr. James Shearer is going to give us a presentation of the survey, the main insights. It's a really rich survey, but we've tried to pick up a number of key insights, and then we shall then open up for a panel discussion after that. James, Dr. James Shearer, are you ready to give the presentation? And are we able to see the screen? And I think while it's coming on, I think Dr. Korir has joined us. So let me invite Dr. Korir Singoe to say hello to us. Dr. Korir, hello.
Hey, Aidan, and hi, everybody. It's a real pleasure to see you, Aidan, and to participate, albeit briefly, in this important conversation. I'm really grateful that Twaweza was requested me to be part of this. Thank you very much.
We are really happy that you're able to join in this conversation, and we hope you'll at least have time to see the presentation and then Indeed. Give us your insights before we let you go on to your other duties. So, James, how are you? Good morning, James. Are you ready to give us the highlight of the survey? You need, maybe I can unmute you, James. Oh, let me see if I can find you. This technology is very, okay, let me unmute you. James, you need to unmute. There we go. James,
yes.
Good morning.
Good morning. How are you?
Fine, thank you. So welcome, James. Share with us the presentation. Let's dive right into it. Everybody's itching to know how Kenya is coping with COVID-19. Karibu.
Good morning, everyone. It's my pleasure to make this presentation, particularly on this topic. I think almost everyone has been affected by measures that have been put in place to prevent the spread of the virus. And I think at the back of your mind, what is probably torturing most of us is how citizens are coping up with the measures that the government has put in place to prevent the spread of the virus. So today we are going to hear we're going to present information with regard to citizens' view, how much knowledgeable are they with regard to the spread. We're also going to hear issues to do with attitude and practice. Welcome. As our CEO has introduced the survey, the survey was conducted between 29th of May and 30th of June this year, and we're able to put together around 3,000 respondents, and we use mobile phones to be able to reach them, get their views, put them in a system such that you could be able to analyze the data and be able to generate the results that I'm about to present. In a nutshell, the presentation is divided into 4 parts. We are going to hear something about knowledge. You're also going to hear response, both from the government and from Wananchi. You're also going to hear something to do with issues to do with economics, how citizens are coping up. We also going to have a such session whereby we are going to conclude, get to hear an overview of the findings. Now let's start with the knowledge. What do we know as citizens? Because here we are, okay, the data is representing views from citizens. What do they really know? I think it's quite fortunate to learn that almost all citizens are aware of COVID-19. And I think I need to appreciate what government has done, and even other civil societies, churches, and other stakeholders, because they have promoted awareness in a way such that no one can claim that he or she hasn't heard about the virus. From the findings, we find that 63% said they are aware and quite aware about it, whereas 37% said that they are aware that we have COVID-19. Now, among the population, it's less than, okay, around 1% are the ones who either don't know or they are not aware, which I think it's a very small percentage. It was also of interest to aggregate the percentages such that we can be able to get to know how men and women fared, about the statistics by gender, statistics by age, and statistics by region. And from what we see here, it's like, although 63% overall claim to be aware, we found the statistics differ between men and women, because from what we are seeing here, more men claim to be aware than women. I don't know why, because they claim to be aware, but from the statistics that we have had from the media, I think men are more affected, because like I normally listen to this news on a daily basis, and almost 2 out of 3 of those who have contacted the virus are men. So I don't know why awareness level seems not to go quite well with ways in which these people or men, the measures they put to avoid contracting the virus. When you look at the awareness by age, we find that the younger you are, the better in terms of being aware. From what you're seeing here, the age group that is leading, the age group between 18 to 34 years, we find that almost 66%, that's 2/3 of guys aged 18 to 34 are quite aware, compared to over 57% of those who are above the age of 55. I wonder why these statistics are like this, because we find that those who are quite susceptible in terms of fatalities are those who are aged above 55. And I think awareness level need to be high among these people for them to be able to put measures to avoid contracting the virus. When you look at the statistics by region, and basically let me say something about the region. We decided to have like 4 domains. We have Nairobi, Mombasa, where the lockdown was enforced. We also collected additional information from other urban and other rural areas. Now, what we need to say is that the numbers or the people that were interviewed in Nairobi were around 450, which is a big sample for us to be able to make inference. The same case with Mombasa, we had over 400 participants. Meaning that in Nairobi, awareness is quite high, but I also wonder why the level of infection is quite high compared to other regions. Now, most of the citizens are aware that the main mode of transmission. It's quite evident that 8 out of 10 understand that it's through human contact that you can get, or the virus can be transmitted. Almost the same percentage, that's 80%, said if you cough or sneeze, you can easily infect your neighbor. And in terms of contracting the virus by touching contaminated surface, we found 57% of the citizens said you can get the virus if you touch a contaminated surface. So what does this tell us? That awareness level is high, and most people are aware of ways in which you can contract the virus. Most citizens identified public places as the most likely places of exposure. Now, the question that was asked was, where do you think someone is most likely to be exposed to the virus? We found the values are quite high, like getting the virus in public places. 85% said you can mention public places. 58% said they can get the virus if they attend weddings and funerals. And I think the government need to up the game, although they have instructed chiefs to be present whenever such functions are taking place, because we find that almost 48%, 42% don't think that they can get the virus if they attend these public or social gatherings. And fortunately, 45% acknowledge that they can get the virus if they use public means. Now, what does this imply? We understand it's a small number or proportion of Kenyans who own a car. And basically, the statistics are linked to most people having to use public transport so that they can be able to move from one point to another. But awareness level should be higher when it comes to this. And those who are using public means should be more careful. Now, 10% of those who are interviewed said there are high chances for you to be exposed to the virus if you visit the hospital. It might be seen as if it's a small number, but I think the doctors in this forum might help us to be able to understand. Could it be related to the reason that there are people who, even when they are getting ill, they prefer staying at home rather than going to the hospital? Probably we can explore and get to know whether could it be the reason, because 10% of those who are interviewed said they can get the virus if they visit a health facility. Now, awareness level is quite high, but still there is a lot of misconception in our society, because the government has pumped a lot of money in terms of promoting awareness, but still 36% of Wananchi say that it's a germ weapon that was created in the lab. It might be true, it might not be true, but I think we have more important issues to dwell on rather than the origin of the virus. 25% also claim that drinking ginger and lemon and honey or other herbal drinks can help cure the virus. I think in the last few months, we've heard of what has happened in Madagascar, and I think there was a concoction that was highly publicized, although I don't know whether it's working or not. But the most shocking thing here, we found that 38% of the people who are interviewed, or the population, says a person who shows no symptoms cannot spread the virus. I don't know what we need to do, because we already know that the moment you get the virus, chances are high that you can easily spread it even if you're not showing the symptoms. And basically that's why, and maybe people took for granted, because I'm not feeling bad, I don't even need to put on mask and such kind of thing. So I think we need to have this reversed such that we can have a higher percentage of people who are aware, or who should be aware that even if you're not showing symptoms, you can easily spread the virus. Now, 38% of the people who are interviewed say that those who have recovered should be avoided to prevent the spread. And I wonder why there's this misconception, because the moment the virus gets out of your system, you can easily interact with people. And I think that's the reason why there's a lot of stigmatization among those who have recovered. And I've seen a few people, heard of a few people, even when they test positive, they don't want even to disclose, even some to some of their family members, because they know that there'll be that stigma, as in they'll be thrown away and they wouldn't be welcomed in their community. So we need to do more so that we can be able to fight this misconception and help the people who have recovered to be integrated back to the society. The other question that we need to ask ourselves, are we really worried? Because as Bwana Aiden mentioned, when the lockdown was lifted, we find that the numbers increased exponentially. Does it mean that people are not worried? Let's hear what the statistics are telling us. Citizens see older people, children, and those with pre-existing condition as being most at risk. Now, this is how the question was asked. Who do you think is most at risk of contracting the virus? 70% mentioned old people, but 42% mentioned old people as their first mention, meaning that it's quite evident that the elderly are known to be more susceptible compared to other age groups. Among the 55% who mentioned children, it's only 13% who mentioned children as their first mention. What does this mean? Awareness level is quite high. And it's like, as you grow old, you are already predisposed, or you are already at risk, especially when it comes to the disease. And those with pre-existing condition, you find that 42% claim or said those people are at risk. Then, therefore, it means that those who are outside these categories that I've mentioned think they are not at risk, and probably might see in, later that there's a lot that we need to understand, or there's a lot of messages that we need to pump so that Wananchi can be able to be more cautious on ways in which they can help to stop the spread of the virus. 6 out of 10 citizens are very worried about coronavirus outbreak in Kenya. Now, here what we did, we wanted to get to know in terms of worry, because it's already known that the virus is spreading across the country. And by the time when we were collecting this information, there are a few counties whereby they had not yet reported a positive case. And I think this reflects why the percentage seems to be slightly lower when it comes to the county compared to what is happening at national level. We decided to disaggregate these figures further by age, because those who are very worried are 60% at national level compared to 49% at county level. So we disaggregated the figures by gender, by age, and by region. And the most shocking thing is that, especially when they disaggregated the percentages by gender, women are more cautious, probably because of the responsibilities they have. They are the ones who care about their children. So they'll take measures, or they are more worried compared to men. Because when you compare 63% and 57%, although we haven't tested to get to know whether the difference is statistically significant, but as you can see here, it's quite evident that women are more worried, and probably that's why they are taking more precaution to avoid contracting the virus. When we look at the percentage based on age, we find that those who are more worried are those who are aged between 35 and 54. Probably it's because of where they go, the kind of work they do, but unfortunately, because of one or two factors, they are worried, but there's nothing that they can be able to do. The percentages are quite high for those who are aged above 55. Now, in terms of the percentage by region, you find those who are in the rural area more worried compared to those who are in the urban areas. And in particular, those who are in Nairobi, I think, given that the numbers have been high, it's like it has become the norm that they are accustomed to hear more positive people are linked to Nairobi. And that's why those who are quite worried about the virus, the numbers are quite low compared to other regions. Now, when you look at the same figure based on their perception at county level, we find those who are in Nairobi and Mombasa, they have around 54 to 55% compared to those in other regions, because the number is slightly lower. And basically, as I said before, it's because in some places they haven't had or seen someone who has tested positive. Most citizens do not feel at risk of being exposed to the virus. Why? I think this is something that we need to explore further to get to know why some people, or like almost 6 out of 10 of the people that were interviewed, said that they think they are not at risk. When the data was disaggregated further by gender, age, and region, we find that men think that they are at risk because 41% compared to 33% between men and women think that they are at risk of being exposed to the virus. The same case when you look at what's happening in Nairobi, probably because of the activities that happens in Nairobi and Mombasa being the capital city and being large urban centers, probably that's why the perception of being at risk is high compared to other regions. Now, in terms of response, how do the citizens respond to the measures that have been put in place by the government to prevent the spread of the virus? And are we really acting? That's the other question that we need to ask ourselves, because the government can put measures, but we are the people who are supposed to implement. Basically, as we have heard, citizens pointed out that hand washing, wearing masks, and staying at home are some of the key actions that we should take to prevent the infection. Basically, 9 out of 10 mentioned that the use of sanitizer, hand washing, washing hands can help prevent themselves from contracting the virus. Wearing mask came second at 69%. And okay, the way this question was asked, we had like multiple options that you could mention more than one option. So, and when you compare the two, we find that I think washing hand has been a tradition. I think even in the past, particularly if you visit the toilet, you have to wash hand. So, but when it comes to wearing mask, we find the statistics are quite high. But I think it'd be more appealing if the values get to around 90%. And I think that's why in some countries, wearing mask has been made a must. So that I think it's one of the best way or one of the best interventions that has been put in place to avoid the spread of the virus. Now, 4 out of 10 citizens say that money that they have currently would last them for 1 or 2 or 3 days. From what we found here is that 38% say that the money or the funds they currently have can last them for a day. I think this translates to very interesting findings, because if 30% say that whatever they have can last them for just a day, and when we expanded the time frame, 27% said that the little amount they have can last them for at least a week. And the most shocking thing is that only less than 1 or around 4% said whatever they have can last them for at least a month. I think this is shocking. And I think the government need to take these results seriously, because some of the measures that have been put in place really affect people economically. And I think more people are more affected economically than when you look at issues to do with health. In terms of food, 26% say that the food that they have can last for a day, compared to 43% who have food that can last them for a week. So what should the government do if these are the statistics? These are quite, the statistics are quite worrying. And I think probably these are some of the facts that guided the government when they lifted the lockdown, and also put additional measures to help people recover from the effect of the intervention they had put in place. More than half of the citizens agree with the view that many people have resumed business as usual despite of the outbreak. And the figures really differ, or totally different when you look at different regions, because although 6 out of 10 nationally said that business has resumed, we found that Nairobi has the highest proportion. And I think probably it's becomes, that's where most of the business premises are, because almost 7 out of 10 think that business is back as usual. compared to Mombasa, which whereby it was reported only that 15. Those who said, it's only 59% who said business is as usual in Mombasa. But when you look at rural areas, it's only 57%, meaning that most people in Nairobi have gone back to their normal routine. And I think this is one of the reasons why the spread of the virus in Nairobi has been high. Now, the need for money and food motivates people to violate safety measures that have been in place. I think as seen before, whereby almost 4 out of 10 of the people that were interviewed say that they don't have food that can last them for a day. This translates quite well with some of the reasons they gave, because I've heard a few people saying that there's no need for me, it's better for me to die. It's not good for me to die of hunger. I would rather catch the virus because I know after 2 weeks, the virus will no longer be in my system. So I can easily be able to cope up with life rather than dying due to hunger. So what should the government do to help people be able to address this issue? I don't know, given that this message has already been raised, I think it's important to get to hear what other stakeholders has to say to help the government help people to be able to put food on their table. Now, the other question that we need to ask ourselves, the government has put a lot of measures to help Wananchi be able to cope up with the spread of the virus, but do we really trust the government with the measures they are put in place? And there are few things or some of the directives the government has put into place that can help to deal with the spread of the virus. And at the top here, we found that wearing face masks all the times when in public has the highest percentage in terms of being mentioned. But when it comes to the idea or the intervention being supported, we found the statistics differ slightly. There is a gap whereby there's those who mentioned it, but those who support the idea, the number seems to be slightly lower. Now, social distancing, which from here we found that 64% mentioned it, but those who support it are only 46%. In terms of having water and soap next to someone else, next to your business, was mentioned by around 51%. That's half of the population. But those who support the idea are quite less. It's like 4 out of 10. The most shocking thing is the last, what we have on that chart, having public places closed, including pubs and churches. Yes, it was mentioned by 23%, but only 15% support it. I think there are reasons behind this. Maybe there were a lot of restrictions and people, most people like to meet with their friends, go to church and such kind of things. So in terms of gaining support, this intervention really scored quite lowly compared to the rest. Next, 2 out of 3 citizens have confidence in government's ability to handle the corona outbreak. And we compared what's happening at the top. We compared their response based on their perception on what the national government and the county government. And from what we find here, 40% of the citizens are very confident that the national government is handling the outbreak in the right way. And 26% really have some trust, although not as much as the 40%. In terms of sufficiency of the government's response, putting measures in place, providing ambulance and such kind of testing and all that, only 32% are very confident that the government sufficiently provide the required response, compared to 32% who are somehow confident. The statistics, although we haven't shown them here, they're almost the same when it comes to the county government. And if you want to get to see what's their responses, I think you can have a look at the policy brief that will be released later for you to be able to understand how things are at county level. In terms of livelihood, we really got quite shocking results because of some of the things that we found. Because citizens are more concerned about the economic complications of the coronavirus than the health effects. Now, when you hear that, if you are a policymaker, you get shocked because, yes, we have put in place measures to prevent the spread such that people cannot contract the virus because we already know the implication. But we find that most people are more worried of the negative impact, the spread of the virus, or the measures that have been put in place to stop the spread of the virus, because 70% say they're really worried about the negative effect to their economy. Although it's a concern, but to many issues to do with the economy, I think supersede health effects, because we have like 70%, that's 7 out of 10, compared to 3 out of 10 of those who are worried to what's happened to their health, like some losing like a relative or family member, contracting the virus, found the value is quite low, that's 25%, that is 1 out of 4 people. And getting infected with the virus, it's around 11%, and global disease infection, which is around 10%. So what can we do as stakeholder to help people be able to realize that although the implication or the effect of the intervention that have been put in place are there to help them be able to prevent the spread of the virus, we need also to have something in place to help them be able to cope up with the negative impact of the measures that have been put to prevent the spread. The biggest impact of the coronavirus outbreak on Kenyan household has been on income at job. I think from the previous slide, it was quite evident. And here we decided now to get to know, in particular, what do household claim to have been affected by the spread or the measures that have been put in place. So 85% said that they have been affected. Probably 1 or 2 members has lost a job. Some people claim that financially things have changed to the worse. But we find that increase in food prices also scored a significant figure, because we have 28% of those who are interviewed said that food prices have gone up. And I think basically the reason for this is because of the curfew and the lockdown that had been put in place. Now, those in terms of other factors like feeling lonely and reduction in terms of interaction with friends, we had around 23% of people who say that they have been affected in that dimension. The values seems to be like almost the same when you compare other regions, comparing Nairobi, Mombasa, other urbans and rural areas, because it's like 9 out of 10 said they have been affected. Maybe 1 or 2 people have lost a job or their income has reduced. We also found that half of the household have seen food prices increase in the previous 2 weeks. And it's almost half, that is 52%, said that prices have increased. And I think it's because of the measures that have been put in place. I don't know what the government can do. Probably they can control the prices, which might be a little bit difficult, but I think the government need to do something to ensure that prices do not go high. Because I'm imagining if the measures that have been put in place in countries like Italy, Great Britain, if they were implemented in Kenya, I think things could have worsened. And that's why I commend the government, because although they had put these measures in place, they were quite reasonable, at least to not to have them as the way they are in other countries, but to allow some flexibility. Unfortunately, we have misused the privileges that we have been given. And I think that's why it will take a little bit longer for us to be able to contain the spread of the virus. Now, 7 out of 10 households reported that their food intake has become worse in the previous month. I think this reflects what we had seen before, whereby a big number, that's 4 out of 10 of the citizens, said that the little food they have can last them for like a day or a week. So 26% said the effect have been worse. and 42% said things have worsened. So in general, almost 7 out of 10 of the residents, of citizens, think that their basic daily food intake situation in their household in the last 1 month has been affected. Food stress is being felt in all areas. When you look at Nairobi, from what we have here, the percentage are almost the same, because we have 26% in Nairobi. Mombasa, it's around 29%. Other urbans, we have 26%, and other rural areas, we have 26%. So I think the effect has been felt across the country. So we can't just claim that it's only in Nairobi where food crisis is an issue to Wananchi. I think in terms of intervention to help people to cope up with the effects of the intervention that have been put in place, I think we need not just to think of where we had the lockdown, even other places where the lockdown was not there. I think still food issues or food crisis is a big problem. Now, in conclusion, we find that things are not bad in terms of awareness. And fortunately, a lot of misconception still remain. For example, it was people who say that the virus was created in the lab, and those with no symptoms cannot spread the virus. The other good thing that really, which is encouraging in terms of the intervention or the public awareness that has been there for the past few months, is that awareness level is quite high. High proportion of citizens have reported that they have had these messages or these public health messages on the media. So what does it tell us? That awareness can be high, but when it comes to the implementation, things can really change. And in terms of the government having capacity to contain the spread, the public is quite confident in its ability to respond effectively to the outbreak. Although there are complaints here and there due to issues due to the economic effects, but Wananchi really appreciate what the government has put in place to help the spread of the virus. Citizens are currently far more concerned about economic impact of the outbreak than the health implication. The government will need to manage these concerns with care, as there are clear possibility that frustrated citizens trying to cope up with difficulties putting food on the table will lose confidence in the national response and start taking preventive measures less seriously. Basically, from what we have seen in conclusion is that it's like bringing a patient to a doctor. And this is a doctor who has already given some medication or prescribed some medication to this patient. The patient has been quite happy to take the medicine. Unfortunately, the medicine had some side effects. Now, it's upon the government, which in our situation is the doctor, to find ways in which they can have contain the effect of the side effect of the drugs that have been administered, because sometimes the effect of the side effects can have a bigger impact compared to the benefits that the patient will receive after taking the drug. My question is, will the doctor increase the dosage or will the doctor reduce the dosage? And if he maintains the dosage, is he going to provide another medicine to help counter the side effect of the drug that has been administered? So it's upon us as stakeholders to help the government be able to understand and be able to respond effectively to help citizens be able to help to contain the spread of the coronavirus. Thank you. Aiden, back to you.
Thank you so much, James. Sorry, I needed to take a microsecond to unmute myself. Thank you. That was a very rich presentation. Lots and lots of data to unpack for us. And I think a lot of insights we're getting from what Kenyans are saying. I know you summarized it, but the things that jumped out at me very quickly were the awareness overall in Kenya is fairly high, not universal, but it's fairly high. But there's still some gaps, I think, there to fill. And, you know, the coronavirus really finds those gaps to wreak its havoc. Secondly, trust in government response also seems quite high, but how does one maintain it or make sure it doesn't get eroded? But I think for me, what really jumps out is that the financial and food security pressures on Kenyans are number one in terms of their priorities, and they really, I think, are going to challenge their ability to cope with the challenging coronavirus that is the country. So I wonder whether Mr. Marco Tani can mute himself because we can hear your side conversation. So I wanted to now just invite some thoughts from some of our panelists here. And let me see, I need to navigate my computer myself so that I can find the right, maybe I can navigate on another one here. Maybe to start with Korir Singoe, what struck you from what you heard from the presentation? Anything that surprised, that jumped out at you, or things that sort of reinforced what you already know? Dr. Korir, karibu. Hello. You might be muted. I think I'd have to ask my technical team to unmute our panelists so that they're able to contribute to the conversation.
Sarah is the host. Sarah, can you unmute? Jen, you are the host. Is it possible to unmute them?
Hi, Aidan.
Hi. Sorry, we need to get ourselves more nimble with our technology. But I was just asking, what, did you hear my question, Dr. Korir?
I heard your question very clearly, and let me reiterate what I said earlier, which is that I want to really commend Twaweza for this timely survey on the perception of Kenyans vis-a-vis the COVID pandemic. For me, really, I mean, I work for government, but I come at these issues from a governance lens. And so my biggest areas of focus really will revolve around, the governance issues. I think what jumps at me is the fact that quite a huge chunk of people in Kenya still view the government's response positively. And so we're talking about 6% of confidence levels in how government has handled the crisis of the pandemic. And we have always said this, especially in the context of the open government movement, that when you empower citizens with information regarding decisions the government makes, that correlates with an increase in confidence levels. And so, when you look at the level of confidence that has been cited by your survey, I would attribute it largely to the fact that, government has disseminated from the word go information regarding the nature of this virus, how it spreads, who are the most susceptible, demographic group, and how can one address this challenge? How can one protect themselves? And so, for me, that confidence level is certainly the bulk of it, in my view, is attributed to, the level of information the government has shared, with the public. I would want to see a situation where that feature and that posture that, in terms of sharing information by government would escalate to, to encompass, the financial side of it, which is, how government is actually using and deploying resources earmarked for COVID response, to address the pandemic, and
but
so.
Cornelius, maybe if I might interrupt you there, there's the resources for dealing with the disease, the virus itself, but the survey shows that Kenyans are really worried about bread and butter issues, businesses,
Correct.
jobs, food on the table. How can, or what is the government doing to address that side of the issue, the economic side, and less so the health side, even though this side is very important?
No, I hear you, Aidan, and this is an area where government has actually grappled with quite a bit. The decision whether or not to impose a lockdown, what times to impose a curfew, when to lift all these conditions, all of those decisions were also informed by the economic implications of the pandemic on jobs, on employment, on livelihoods. And so you have seen, for instance, that the Kenyan government has actually been very measured, are very targeted in the way it has focused on these issues. And so for example, in terms of addressing livelihoods, government has rolled out a program called Kazi Mtaani within informal settlements, where about 10,000 young people are already within that program. But the idea is to scale up that program to reach about 200,000 by the end of the year. Government has also rolled out a program called the National Hygiene Program that seeks to reinforce, the sanitization, process, the cleaning, the fumigation, the disinfection. Again, that's a huge program where government has put in money. Government put in measures, for example, tax measures to give relief to people who are earning, I believe, less than $240. And then what has also happened is that government has created a fund to stabilize small and micro enterprises. Among others. So definitely.
Unajua niko meeting ingine hapa, wacha ni screenshot tu sahi.
I'm afraid there's a bit of an interruption.
Yeah, there is.
Sawa. Wacha ni screenshot tu sahi. Si nikutumie tu WhatsApp, please.
We need to mute the person who's speaking. Jane, please. Sorry.
Sawa, wacha nikufuatie. Lakini vile niko kwa meeting ingine na multitask. Lakini wacha nikutumie.
Nasikia meeting yako.
Sorry,
Abraham, go ahead. Go ahead.
So I think the argument really that I'm making is that government has rolled out quite a number of measures, but these measures, Aidan, are still way inadequate to respond to the massive job losses that have, for example, been witnessed in the tourism sector, in the transport sector, in the construction sector. All of these have begun to have serious implication on household incomes. And we are seeing huge movements of people from Nairobi, back to their rural homes because they can no longer sustain themselves in the city. And as they move, obviously, there are all these cross-county infections that are beginning to balloon, which begins to have serious implications on the extent to which counties have the capacity then to be able to respond. The other area that I feel government has...
Because I think you make an important point about the county perspective here, and I want to hopefully invite Dr. Mulwa, if you're ready to just comment on the county issue. One of the survey findings was that people are more worried about coronavirus at the national level, less worried at the county level. This might be because maybe at the county level, Makueni, other places outside of Nairobi and Mombasa, there was much less in terms of transmission. Dr. Mulwa, what are your views? Are their worries corroborated with your own experience and experience of your colleagues in the ministries of health across the 47 counties? What are your views on that one, Doctor?
I think we must appreciate that, and this research actually confirms what I have always been thinking, the decisions that government has made as far as response to COVID-19 is concerned. And also because this disease having come from across the borders, first to Nairobi, Kajiado, an hotspot in Mombasa and Mandera, then the rest of the country, due to the restrictive measures that were taken, the rest of the country was cushioned. And I would like to say we were lucky in the sense that we were according some time to plan and prepare the communities, including the risk communication to the communities. And therefore, there is that feeling, and every time, because even as I speak now, I'm speaking from the village. Every time I'm in the village and I'm in Makueni, I get a lot of people get this perception, this is a Nairobi disease. And yes, and when you meet people, despite having done a lot of education, a lot of risk communication to the communities, employing community health volunteers, engaging community health leaders, opinion leaders in the communities. And for example, in Makueni, I have a team of 50,000 who are charged each to ensure that they reach out to 5 households so that all the 250 households in Makueni are reached. But still, when you talk to people around, they tell you, yes, there is corona is there, but corona is a disease of Nairobi. So the restrictive measures add to effect. To the health system, to the government, we bought time to prepare. But to the citizen, it created a false sense of security that this disease is from Nairobi. And if I tell, like I tell anyone from the village here, I'm from Nairobi, they run away from me. But within interactions, they are okay because they feel this is a disease. And of course, sometimes it's important also to understand them because this disease, by its spread, is a disease of clusters. So therefore, if within your clusters there is no movement, then of course their thinking is also justified. But the point that I want to drive home is with the opening up, and this survey was done before the opening up of the country. If a similar survey is done, I am sure the situation will be completely different because now what we have.
In what sense, Doctor? In what sense? In terms of awareness, support for, or in terms of the spread of the virus? What would be different?
What will be different is because, like Abraham mentioned, there were mass travels from Nairobi and Mombasa, of course, because of economic issues. And now we have so many pockets, so many people who travel from Nairobi who pose a risk in terms of having come into contact with people. And that's exactly what we are seeing, that you go from one village, there's one person, one member of community that had traveled, and there are a few people in that community that are positive, then we move to another, and therefore, that information is now has changed in the sense that they are already seeing their neighbors, people within their community that have turned positive for COVID-19. And therefore, that information, I want to believe the status that was in June has changed a bit in the communities.
Okay. And let me bring in here Bernice Mbukimburu to give us your sense of what you're finding. One of the things that COVID seems to be really exposing a lot, and I think it has come out a bit in this survey as well, is the inequality between especially young people and older people, and then the gendered inequality as well. But just give us your perspective on what you're seeing in the survey, but how does it resonate with the work that you do with young people and in terms of its sort of social justice dimensions, not just the economic or the health dimension, but the social justice dimensions?
Thank you, Aidan, and apologies, I was not earlier on during the introduction. I'll just take 1 minute to introduce myself. My name is Mbukimburu. I work with young people. I'm a youth worker and also a policy and youth advocate. And I'm excited to be part of this conversation because I also convene the youth serving organization. So I have a bigger scope of how the sector is and how young people have been affected by COVID-19. First of all, I would like to say this is a very well-researched work. And I really appreciate Twaweza East Africa and the team for, just bringing, just initiating this research. And it's a very well done. Really commend you. And of course, the sample size is quite good. 3,000 sample size is a good one. I really like to appreciate the work that you've done. So first of all, I would like to say, for me, the biggest highlight was where the question around how many people, for how long would you survive with the food or the money that you have? How long would you survive with it? And of course, there was a different percentage of a day, 3 to 8 days, and there was a certain percentage that was 13%. And working with young people, and of course, we've had a lot of statistics, and we're saying that over 1 million young people have lost their jobs over this COVID-19 period. And my question, sorry?
Is that 1 million over?
Yes, over 1 million young people have lost their jobs over the COVID-19 period. That was in the newspaper 1 or 2 months ago. And my question is, there's a percentage that said not applicable. There was 1 day, 3 to a few days, and a month, 1 to 2 to 3 months. But the 13% is what I am concerned with, because young people right now do not have a source of livelihood at all. So if you ask them whether they have food or money for that day, they actually do not have. So that 13% that actually said it's not applicable is what we need to be more worried about, because actually people are really going hungry during this COVID-19. Okay. And just to say that, and of course, pointing out to my colleague who talked about the kazi mtaani, and also goes back to my comment. I'm actually surprised that the respondents are very comfortable with government response. We have a lot of accountability issues in terms of how the government has dealt with COVID-19, and of course, we'll look at the health perspective. Mental health is a big issue among young people. And then, of course, in terms of general health, we are looking at so many facilities do not have enough bed facilities, and especially in the county, we don't have enough ICU facilities. And of course, now there's a lot of government giving directions on having at home care. But I would like to say that I'm actually surprised, because if you look at the money that was given, by this IMF, World Bank, some of those have come out that they are actually in people's bank accounts. So I'm actually surprised that the survey shows that the government is responding to it very well. So I'm wondering, is it that because they do not have information about some of these things that the government is supposed to respond? Because I mean, if you have money that's allocated to deal with COVID-19 being in people's bank accounts, then that worries me, and people are going hungry. And as I said, the 13% for me is actually a red flag. So in terms of just going to the kazi mtaani that my colleague has mentioned before, I work with young people, in different, sectors in Nairobi and across the country. And I can say the kazi mtaani, young people, there are so many ghost workers as well. And just the other day, Citizen TV highlighted how the kazi mtaani, they're supposed to be getting 400 shillings per day, but they're actually getting 140. So a young person has gone out there, to dedicate their time to be able to, they are sure that their 400 shillings that it has been publicized, and when they were signing the contract, that is their money, that's the money they'll be receiving. And then at the end of the day, they get 140 shillings. For us, it's just using these statistics and saying, this is what young people are saying. They are suffering. The economic perspective is a hard hit for them. And we need to honestly remunerate them according to what we had planned. So in terms of
one last point, I want to invite Dr. Were. Carry on, Buki.
Sorry,
one last point you're going to make, and then I want to invite Dr. Were about and ask him to contribute.
Okay. Sorry, I think I just missed that point. But anyway, as a conversation
let me invite Dr. Were. But the points that you're making are very interesting, that the youth perspective is actually slightly different from what the overall national surveys are finding. They have no money, so therefore, really, the question about how long can you survive if in a lockdown, for them, it doesn't matter. That's 13% who said this is not relevant to me because I have no money at all. So I don't even know perhaps how to answer that particular question. Dr. Were, I see you're still there. Thank you for being still with us. And I want to get also your perspective from a health side. We talked a little bit about the economic and financial side, but from the health side of these things, we saw, not in the survey, but in the introduction, that the number of infections and deaths has doubled in the last month. So maybe to ask you, what are you seeing as a doctor's community in terms of health-seeking behavior of Kenyans? Are they still going to the hospital and to the health facilities, or are they handling things themselves at home? Dr. Were, Karibu.
Thank you, Aidan. First of all, I'd like to appreciate Twaweza Africa for this knowledge attitude and practice a survey that you did. Actually, I've just been taking notes, and I think it's very good information that is coming out that we can actually use in terms of policy direction. In terms of initially during the pandemic, people were scared. I think the way we delivered the message about what COVID is, I think we didn't get it right, because we delivered it from a medical point of view, and we're not able to communicate effectively with Wananchi. And that's why you saw, even from your survey, most people, yes, they have full knowledge about the disease and the infection prevention measures that they need to take. But that necessarily does not translate to them actually following it and doing that. Because if you look, if you just walk out of the office and look at what outside, you'll find that most people are not wearing masks. There's no social distancing, issues of hygiene. They're only doing it because the government has said, but they do not actually take it seriously in terms of its impact in terms of control of the illness. We are seeing patients coming back to the institutions. I know you noted that 10% had noted that our health institutions are a point of infection, which I think it is. I agree with that survey, because of the most of the when patients come and they're gathering there, even if you see where we do our mass testings, our testing centers, you all come together, both the infected and the infected. But I think the take-home message that I want to pass is we need to repackage how we communicate to the public, and we need actually the public to participate in terms, because it's a community initiative. We all don't follow these instructions, then we'll continue seeing the surge. And you saw when we opened up the country, people went back to work according even to the data that you've shared with us, and life resumed back to normal. Of course, there was economic pressures that were making people go back and resume their normal life. But I think if you're to control this pandemic, we need to go back to the drawing board, communicate effectively to the public, provide good support in terms of the socioeconomic issues, and ensure that actually the patients who need to come to our institutions, then they feel safe coming there, because that 10% is actually very high from a medical perspective, because 10% to someone who needs maybe to be seen, let's say for another ailment, if he doesn't come and he's seen by a doctor and attended well, then that can result to a very bad outcome. So I think we need to communicate.
So I got two questions for you. One is, how would you communicate differently? I mean, what is the message that you send to Kenyans in order for them to take the personal hygiene measures that are necessary to curb this thing? How would you intensify that uptake on the one hand? And then maybe for Dr. Mulwa after that, because I really would like you to respond to Mbuki's challenge that actually young people are being seriously underserved, even by the health services of Kenya. So Dr. Mulwa, how would you respond to the challenge that Mburu is putting forward? But for you, Dr. Were, how do you get Kenyans to take up these measures that the government is putting for them to be safe and virus-free?
I think initially you saw there was an effort to try to communicate in vernacular language, in a language that most Kenyans will understand. So I think we need to break down in using various media modes the message about COVID. First of all, we need to destigmatize it, because getting a positive results and does not necessarily mean it's a death sentence, or compared to more other serious infections like Ebola, Zika virus, yellow fever, which has been with us for a very long time. So we need to break it down that this is, yes, it's a bad flu, and we need to take precautions to control it, as we encourage our scientists to actually come up with a vaccine to stop this. So we need to communicate in the language that Wananchi understands. And I think the communication experts have a lot of work to do and to guide the Ministry of Health, Council of Governors, so that they can communicate effectively to the public. And the youth aspect. I
was actually going to ask Dr. to handle the youth aspect at the county level, where the rubber meets the road, as it were, with the health provision. Dr. Mulwa, how do you assure young Kenyans, 18 to 35, that they've not been forgotten and left on the side of the road with respect to this thing?
Thank you very much. Until last year, I was a youth, actually, and therefore I was in that bracket, and I can speak to how most of the most of the programmings that are done in this country do not actually target, especially the young adults, which is between 18 and 24. By the time one gets to 25, they are able to get information. These young people do not have televisions of their own, and therefore, if you want to pass information on television, they will, when they get the opportunity to be the ones in control, they will be watching a movie, listen to music, and all that. And therefore, unless you want to convey your message through those platforms, you are not likely to reach the youth. Even when you go to church places, even if you go to chief barazas, you rarely get young people attend this. And therefore, the best way to reach the youth is to use their peers to reach out to them. That has not happened, and I don't think even in this response to COVID-19, there has been any effort to actually reach the youth through their peers.
But Dr. Mulwa, let me challenge you there. You said you have 50,000 people in Makueni County alone, each going to the 5 to 5 households in order to reach 250,000 households in Makueni. How come young people are being reached? We have 50,000 people on the ground.
Yes, we have 50,000 people on the ground, but the reality is you will get the older youth. And I'm very specific on the youth that is the challenge, is the youth between 18 and 24. So you are likely to get the older youth. We actually have youth in this group, but it's the older youth. And like I mentioned, I actually said that I am a youth. I was a youth up to until last year. But the one thing that I know, the younger youth don't actually see anyone who is above the age of 25 as a youth anymore. So even as I speak to them and I tell them I'm a youth, they look at me and like, you are an ancestor. How can you be talking about the issues of youth? So we need also to be that sensitive to that cohort, which is 18 to 24, which to me, and when I look at all the problems that we have in terms of the adherence, in terms of social distancing, in terms of sports activities, these are the youth that have not been reached out. Even in delivery of health services, their needs are special, and we need to get a way of addressing this. I was trying to put a point that that cohort of young people love music, they love sports, and if you are to reach out to them, you must be aligned to what interests them. And I've had some musicians who have tried to do, and fortunately, I have some youth that I interact with and that I live around, and I see how they get excited when they hear those music about COVID-19, and that could be the only source of information. I try to talk to them, but they are privileged. They have a CEC, they have a minister for health, they have a doctor in the house, and therefore they are able to get that information. How many youth have that privilege? And the point is, unless we have a peer mechanism of reaching the young people, we are likely to continue passing this message, but not getting to the audience that we require. That to me would be something that is actually a missing gap, even in our programming for response to we need to learn also from the HIV space. In 2016, you are all aware that HIV amongst young adolescents was contributing to 51% of the HIV. But using years, we were able to reverse that trend. And I think that is now has gone down to probably 38, 37%, which is actually a good way, because in our HIV programming, we had not seen that that cohort requires special attention. But now with that, we are seeing that using their peers, we are able to reverse that. I think the same thing needs to be done, because the challenge with these young people, especially with COVID-19, is they will be asymptomatic carriers, and therefore they will sustain the epidemic within the communities, because they themselves are not likely to be to be symptomatic, but they will be able to spread to other vulnerable groups.
Dr. Mulo, let me ask Mboki to react to what you heard from Dr. Were and Dr. Mulwa. Buru, are you convinced? Can you help these two doctors out in terms of reaching to young people on the one hand? And the second one, Mbuki, is on the, I'll call it the gender aspect of the inequalities that have really come to the fore as out of the pandemic. Caregivers, the burden is really falling on them to look after the families when jobs are evaporating and people are sick. It falls on the women and maybe young girls. Could you comment a little bit on how that can also be alleviated? But the first one is, are you convinced by Drs. Mulu and Dr. Were's thoughts about communicating to young people?
Thank you, Aidan, for that question. I think I want to respond to Dr. Mulwa's concern. I think the ages between 18 and 24, yes, but I think the biggest concern, because this is the age group in which they're in universities, so I think their biggest around this time is around education. And you've seen different university leaders coming on board to talk about, what are the institutions doing to ensure that the classes are still ongoing, because also when there are so many narratives of the Kenyan system also having tactics to delay young people, to stay in school, and then, you can't compete in terms of the global perspective. So I think we have seen university students also coming out on the education perspective, on the impact of it by the COVID-19. So in terms of information, I think for me that is not really a problem by itself, but I think even just people below 35, I think the biggest challenge within young people right now is access to a livelihood. Honestly, I think that is the biggest priority. And as you can see in the survey or in the research, the bigger problem is not actually the impact of COVID-19 by itself in terms of the health perspective. The biggest challenge for young people right now is access to a livelihood. And I think that's really the main challenge. And I want to address the first question you asked me that I didn't respond to in terms of social justice.
Right.
During this time, young people are really suffering in terms of, we have issues around teenage pregnancy, we have issues around sexual and gender-based violence. And these are young people who have come to the urban areas to be able to, get a source of income. But then, and then in the process, they end up living together. And now the sexual and gender-based violence is on the rise. And we know in our Kenyan context, we don't have safe spaces for such cases. So, and of course, we need to applaud the civil society sector that has really come out strongly to be able to support the victims of SGBV, and just supporting the whole sector to be able to how we can deal with teenage pregnancy and SGBV. yeah, so that's what I would say in a nutshell, in terms of the impact. Sorry, I missed on the Dr. Mulwa's, not Dr. Mulwa, Dr. Were's comments. Maybe you could take me through that. Sorry about that.
No, it was very quickly, if I recall correctly. Kenyans are aware, but they're not really acting in the manner that will allow themselves to be protected from the COVID-19. And he said that maybe we communicated this in too medical or too scientific a way, and that perhaps communicating in people's local languages, the vernacular, would do a better job of getting the message across to young people. But you don't need to respond to that. In fact, what I want to do is prime people to now maybe ask their questions or make their comment to our panelists, or even to us as Twaweza, my colleagues who did the survey. But I want to ask a final question of Dr. Were before we open up the floor, and that is this. If Kenya was to experience a resurgence of infections, would you recommend another lockdown or not? Dr. Were?
I won't really recommend another lockdown. You know, initially when we went for a lockdown was to allow us time to actually prepare so that you can better respond when you have the surge of infection. I know we tried doing that. We've been seeing in the media the accountability issues in terms of preparing proper PPEs, having functional units all over the counties to respond to that. We didn't do a very good job, and I think this is the time we are trying now to fill those gaps. I won't recommend another lockdown. What I recommend is locking down clusters of infection. So if you're seeing, like now that you have Nairobi, Kiambu is becoming another hotspot, then you can lock those particular clusters and control the infections from there, other than going for a full lockdown, based on the data that you've provided on the economic impact of a lockdown. And further, we know the food security is also an important aspect in terms of health of an individual. So I won't recommend for a lockdown, a full lockdown, but cluster lockdown, where we have surges of infection so that we can control in those particular clusters.
Okay, thank you. So I'm going to invite questions from the floor, and I hope my colleagues will be able to help me to identify people asking. But if you can put your hand up, and I'll see if I can see hands going up, and we can have comments on that. But maybe I can start with one question to my colleagues, actually. I think it was Dr. Mulwa, or maybe Dr. Were, who said, if we were to do a survey now, things would be different because people have gone from the cities to the counties. So the county picture might look different. So colleagues, when are we doing the next one of these COVID-19 update surveys? James, do you know?
Hello?
James, when's the next survey? Kenyans want to know.
Very soon. I think in the next, between 3 to 6 weeks, we might be having another survey going on. Okay.
Thank you. Let me see. I have seen a few open mics, but no hands up. Let me see. I think I see somebody called Lois W. Lois. And then the Evans Ndambuke. Actually, you put your hand up as well. So let me start with Lois, and then we'll go to Evans. Lois, please, Karim. You have a question or a comment? We can't seem to hear you very clearly, Lois. Would you mind then if we went to Evans Ndambuki? Evans, if you could just introduce yourself and ask your question or make a brief comment. Evans?
Hello.
Yes, we can hear you, Evans.
Oh, thank you so much. Mine, I think, is a question.
Mm-hmm.
The government of Kenya has imposed some strict measures to curb the spread of this disease, and we acknowledge that. However, in some areas, it seems that enforcing some of these measures has not been an easy thing. For example, in the matatu sector, in most areas, people are conducting business as usual. And everything seems to be normal. And this, I think, can be a very big challenge and also dangerous in terms of the spread of COVID-19. The Inspector General of Police, Mr. Hilary Mutiambai, recently ordered for removal of police roadblocks, then we remain to wonder who then will ensure that Wananchi is protected, having in mind that most people are not even taking the spread of this disease as a serious thing, as a dangerous thing. And we are seeing things that things are happening in a normal way in our roads, in our most interior areas. So who will enforce some of these measures, including this one about matatus? Thank you.
Thank you very much, Evans. Let me invite Awal from Standard, I think it is. We're going to collect three questions, and then we'll see how we divide them up. Awal from Standard newspaper. Karibu, your question or comment? Oh, Awal, are you on? You can unmute yourself. Or have you asked a question in the chat? I see you've got a question in the chat. Can't imagine the rural areas the study was conducted. I'll leave that one for James. But back to Dr. Were or Dr. Mulwa. Good question from Mr. Ndambuki Evans. How do you protect Kenyans? It seems like the measures, things are being let go, it's being relaxed, matatus, etc. How do you protect Kenyans? Shall we start with Dr. Were?
Thank you, Ndambuki, for that. I think in terms of protecting Kenyans, we as a people, we need first of all to understand what is our role in this pandemic. The government can only do as much, and the healthcare providers, as the frontline health workers, will also do what they can when you need them. So I think, first of all, as a community, we need to actually, once we have understood fully what this pandemic is all about, then comply to the measures that have been suggested by our scientists and by the government, especially Ministry of Health messaging, as our part, as a contribution. If you look at other countries, if you look at Spain, if you look at Italy, those are a lot of public participation and input in terms of compliance to those measures to enable them control that. But we are not seeing that being replicated locally. So first, it has to start with you. Secondly, we have to have a more organized kind of response from the government, where we have better central coordination with the Wananchi or the public good being the most important consideration. Because the news that you've seen in the media in the last 2 days, it's very disheartening, where we have people trying to profit from this particular pandemic, and the way we are seeing how it's affecting our economy. So I think as a country, we are losing our soul, and we need to go back and actually reflect what is it that we want as a nation going forward. So the government needs to come up with a proper response. I'm happy my colleague Dr. Muller is here. Through the counties, we need to have better preparation in terms of having functional beds in our institutions, enough oxygen, so that any patient who presents to our facility then is able to be taken care of well. But I think my take-home message should be we need the public to participate in this first before even considering what the government is going to respond. Because without that, then you're not going to control this infection.
Thank you. Dr. Mulwa, what is your response to Evans Ndambuki's question? How can Kenyans be protected from your county colleagues?
Thank you, Eden. I would say that nothing different from what Dr. Were has just said. The government can only do its part. It's the government's responsibility to protect lives and property of its people. We are facing a new disease that as of December, none of us knew anything about. Yeah. The government came up with very strict measures in the beginning, and of course I could feel the frustration of Kenyans that it's the same government that let in flights from and who are flying in. They are the same Kenyans who are flying out and in, and therefore I get the Kenyans get frustrated and say it's the government that let the disease come. But when you look at the scale at which the disease has spread, that becomes a non-issue, because literally all territories in the world have this disease, and therefore that enforcement component will not work. And I want to repeat that if it is government to enforce the regulations that have been put in place, I can assure you they will not work. The only thing that will work is every individual to take their responsibility, exercise discipline. If you are going to a matatu, and the rules are matatu should carry not more than 60% of the capacity, and the matatu is 14-seater and has 7 people, then the 8th person becomes the last person. So if you are entering a matatu and you are the 9th person, it is not the matatu that is the problem. The problem is actually you. If you are entering a matatu and you have not done hand washing, if the matatu does not have a sanitizer, if you are entering, and I have seen in Nairobi, families that are traveling to supermarkets and malls as if there is no disease. The problem is not the government. The government will give its their directives and guidelines and say, avoid gatherings, children should not be allowed in supermarkets, just one person per family to go for shopping. That is good enough. How? Because we have tried, and I must tell you, you have seen during the first days of curfew, the government trying to enforce some of these things. It comes out very badly. We do not even have the capacity to put it at everyone's household. We do not have that capacity at all to be in everyone's household to ensure that there are no gatherings. Look at the issue of restaurants and hotels and sale of alcohol. What happened? The government, in attempt to maintain sustain business and economic ventures, opens up the sale of alcohol in bars. What happens? Kenyans start partying as if there is no disease. So ultimately, it is about every Kenyan and not about what the government can do. The government will do its part. Of course, we'll continue enforcing, we will continue all this, but it is self-regulation that will help this country more than the militarization of response to COVID-19.
Let me ask both of you doctors this question to speak to what you're saying. What I'm hearing is that really primary responsibility sits and lies with the citizens of Kenya themselves to protect themselves from these things. So let me ask you this question as doctors. Are Kenyans scared enough of this disease, or they are just, are we not scared enough to take those actions? Should we be more scared, Dr. Mulwa and Dr. Were?
I think people, as I've said, there's a gap in terms of communication of what COVID is and what it can cause. In the last few weeks, I've had 4 or 5 of my friends calling and asking, especially from the rural areas, is this COVID really real, or is it just a government ploy to actually get funds from donors? So I think the public, the communication needs to be improved, and it needs to be delivered in such a manner that it does not cause any stigmatization, but delivers the facts in the way a common Wananchi can understand, and not using the medical jargon that me and Dr. Mulo are used to. So once that is done, and people then understand the role which they have to play in order to control this pandemic, then I think we'll move forward. Like a simple thing, when you get sick and you're feeling unwell, you don't need to leave your house. You need to call a number, then you'll be evacuated from there and tested, and maybe isolated, and contact tracing is done, so that you stop spreading the infection. By the time you feel unwell and you want to come to the institution, and you clearly know the symptoms that are pointing towards a flu-like symptom. By the time you enter that matatu, you enter that Uber, by the time you come and sit in the waiting bay in the hospital, you're just making the situation worse. So we need people to take personal responsibility so that we can be able to move forward and help the scientists, the medics, the government to be able to take care of you in case you fall in the 5 or 15% that will actually need hospitalization.
Okay. Mburu, you still there?
Yes, I'm still here.
Now there's a challenge I want to put to you, not maybe on your behalf to others. We need to take personal responsibility, social distancing, hand washing, mask wearing. How realistic is that for many, many young Kenyans women living in the conditions that they live? Can they actually do it? And what's the role of government in that context?
I would say, and this also responds to the question that many people have been asking themselves: why is it that we are aware and yet we don't take these measures? I think for me, what comes into mind is that yes, young people are aware, but then the nature of the hustles of young people, and we know most of young people are actually in the informal sector. Very few young people are actually in the sector. So sometimes you're doing your hustle, but then and that's why you'll see in the research, the washing of hands was more prominent rather than the wearing of masks, because the nature of the jobs, all the hustles they do, they actually do not then have to, for them to actually do the work they do, then they don't have to put on the mask. But I think they definitely need to do more. As young people, we definitely need to do more. But I think I want to address the issue of bars and, the partying thing.
Yeah.
The youth sector by itself is struggling, and of course the drugs as well is a problem within the young people. And sometimes and of course there was a health report, the mental health report that was released the other day, and already you can see the system within the mental health is very weak. Young people tend to go into the drugs and into the partying mode to be able to deal with all these challenges they are having in terms of access to a livelihood, access to food, access to all these stuff. So sometimes, and it's just, if you have engaged with your friends, kuna ile, I know there are young people in the room, and vitu kwa ground huko different, by the way. So you have a situation where your friend is willing to, support you to buy you a drink, but will not support you to buy unga or something. That happens a lot among us young people. So you'll find, let me just go to this friend of mine who will help me sort my problems in terms of, dealing with the whole situation, and forget my problems for a minute. So that's why you see that young people are still indulging into that, but not because they don't know the effects of COVID-19. It's because then the stress and the mental health situation, and they need to get out of that, at least to be sane for a little bit. I cannot conclude this.
Government, but Mbuki, how can government help on that one? What should government do? Something radical, something new, innovative, inclusive. What are you expecting?
For me, what I would say is, let's not do things for the sake. I really like the Kazi Mtaani program, and the concept by itself, like the thinking. But my problem is the design. There's no sustainability, and it's not innovative by itself. I was in Dagoretti South 2 weeks ago. The Kazi Mtaani young people who are working on that program, they are sweeping, they are clearing drainages. How about we design a program that will mentor these young people to do a business, to do something, to support their innovative idea, such that there is sustainability. You deal with that cohort, and then a new cohort comes in, there's sustainability. But this one, you sweep one day, and then you're actually paid 400, but you are being paid 140, and then it's not even enough to pay your rent and food. So I think it's the design of the program. So there's no innovativeness. You're just doing things to tick the box. So I think we need to be very deliberate in terms of coming up with very innovative and sustainable programs for young people, because then we will deal with the issue of mental health. We'll deal with, because livelihood it has so many underlying issues. And if we deal with the aspect of a livelihood, then we'll have dealt with half of the problems affecting young people. The second thing that I wanted to, I wanted to focus, it's around extrajudicial killings. Having worked with young people in the informal settlements, being a young people is one of the biggest challenge for young people, because young people are seen as the robbers, the crime, and the police brutality is very high. The last statistics I read around March was that the people who died of COVID in March, or is it April, was 11 people who died out of COVID. But the people who had died out of extrajudicial killings and police brutality was 15. So the increase of the police brutality among young people especially is a big challenge. And of course, as a sector, the social justice sector, we've tried, working with the Inspector General, all these police enforcers, but it's still a challenge. Being a young person living in an informal settlement is a big challenge. And most of young people, and especially in the urban areas, live in the informal settlement. So it's a big challenge, and I cannot finish this conversation without mentioning about how do we deal with young people in the informal settlements. And you see that these young people whom you're treating them, in that manner, you're still giving them 40 shillings. And that's where the most of Kazi Mtaani programs are. But they cannot even sustain themselves from it. So I think let's address the issue of livelihood, and then we'll deal with all these issues of crime, drugs, and all this floating of COVID-19 rules. So I think once we address the issue of livelihood, we'll have addressed so many of the things.
Thank
you so much.
So we've got 3 more minutes before it gets to 11:30, and I release you all. You've been a fantastic audience, but maybe 1 minute each back to Dr. Mulwa and Dr. Were, and then I'll wrap it up. But in the meantime, I'm going to ask my colleagues to show the very last slide of our contacts and the link where you can get the brief, and you can also ask us additional questions if you need to do that. But Dr. Mulwa and then to Dr. Were, 1 minute each for a last closing comment.
Thank you very much, Ellen. I think this survey gives the reality on the ground. Like Buki said, vitu ground ni different. That is exactly what we're saying. As you respond to the COVID-19 crisis, the public health crisis, we already have an economic crisis that was existing before COVID-19. And all these stories that we are talking about is because we have a crisis upon a crisis. The public health crisis is making the economic crisis worse. And that is the issue that we need to address. The fact that 78% of Kenyan population is below the age of 35 years, and over 30% of these are not engaged in any meaningful engagement, it's a time bomb. Whether we have an epidemic or not, the solutions that we get today must address the economic crisis, especially for the young people. And that is what will make response to the public health crisis that we are in make sense. Those would be my closing remarks. And therefore, as we think about, continue thinking about response as a country, as a county, we need to engage. And I hear what Buki is saying, talking about the kazi kwa vijana. It's something. It's actually doing a good job in terms of ensuring that the young people have money in their pocket. But
maybe you need them to help you design its sustainability and its relevance to be even more helpful for them. I think invite Buki, some advice from them. Thank you, Dr. Mulwa. Dr. Were, you're still with us. It's so great that you're still here. You get the last word as president of the Doctors of Kenya.
Yeah, thank you for that. I think it has been an interesting discussion, and I've gained a lot from even the fellow panelists and from Twaweza. And I'll urge, in terms, when you look about the issues of unemployment, let's also look at the formal sector, because this number that you're saying of youth, kazi kwa vijana, it also needs to be extended to the young doctors and the young nurses who are outside there and want to come in and help us fight this pandemic. So when you talk about kazi kwa vijana, also let us consider the formal employment. Two, I like, this is an appeal to the public that the government and the doctors can only do as much. We really need the public to do 70% of the work so that it can enable us to be able to actually respond. And to the government, it needs to better respond and communicate to its citizens and use the funds that are supposed to help in terms of mitigating the socio-economic impacts, in terms of ensuring that we control these infections in a much more transparent manner. Thank you.
Thank you. Thank you so very much. And it really is left for me to thank you all for your great, great contributions, for listening in, for your questions. Mbuki Mburu, thank you for challenging us out of our own complacency and lack of perspective on the youth and gender perspective here. Dr. Mulwa, thank you for the hard work you put in with your 50,000 peer educators out there in Makueni, but also for your leadership of the other county health executives in Kenya. Dr. Were, thank you again for, I think, the challenge you put on the table here, that really it is about personal responsibility, personal hygiene that will help us turn the corner on this or flatten the curve or suppress it over the long term. But also to my colleagues who worked very hard to put this together. You heard that we hopefully will have another one in 6 to 8 weeks. I've given you a longer deadline, James, not 6 weeks. But we hope to continue this conversation because I think at the core of it is for Kenyans to hear how they're experiencing this incredible challenge that we're all facing, and for government to take note and to adjust course and to hear how best they can serve Kenyans to really help them cope with COVID-19. But with that said, and to especially our press and media members here who are going to help us amplify these findings and really get the conversation, keep the conversation going in Kenya. Thank you for your partnership. We look forward to continuing to deepen this partnership and working together to make lives better for all Kenyans and East Africans in general. So with that, from me in Tanzania, from my colleagues at Twaweza in Kenya and Tanzania and Uganda, have a fantastic morning and weekend coming up. And please, please, please stay safe. Wash your hands, wear a mask, and keep socially distant. Thank you very much. Kwaherini, and have a fantastic rest of the day.